Well, thank you so much, Sharon, and good afternoon, everybody. I so appreciate the chance to be part of today's conversation. We are all physically apart, but we are all in this together. The COVID-19 pandemic has been difficult, complicated, challenging, and humbling. What I'd like to do in the next few minutes is really set the stage for the rich conversations that will follow. Next slide, please. The concept of social distancing, or what we're calling now being physically distant but socially connected, dates back some time. Actually, in 2007, Howard Markel and Marty Cetron, in reviewing extensive information about the 1918 pandemic and the way that different cities and geographies coped with that, coined the phrase of social distancing and really talked about those non-pharmaceutical interventions that could potentially slow the spread and reduce the peak of respiratory pandemics. As a respiratory epidemiologist and public health person, I cannot believe that how everyone in America knows about the trying to slow the spread and decrease the peak, and how expert our country has become in the science of pandemic management. But the concepts basically are including things like personal protective measures and maintaining 6 feet distance from others, and to stay home if one is ill, or now we would say stay home in general, and then community measures, whether they're related to mass gatherings, school, workplace, or as of today, I believe 270 million Americans in 33 states have been asked to stay home by the authorities in their jurisdictions. Next slide. This pandemic is hitting many areas of the world, and the United States continues to be in the acceleration phase. This map looks at the 3-day period from March 23rd to 26th, and the redder areas are the ones with the greatest acceleration of disease, with 151% or more increase in that 3-day period. Take a look at the northeast of the country, at the New York and Boston area, and then turn to the next slide, which shows the subsequent 3 days from the 26th of March through the 29th. And you can see that the red dots in that New York, Massachusetts area have shifted to more peri-urban or rural areas. So really what we're seeing is hard-hit states and then a spreading from urban to peri-urban to potentially rural areas as this virus really takes off in one community after another. Next slide. CDC modelers have looked at the potential effect of a pause where we reduce school contacts by about 80%, work contacts by about 50%, and have about a 50% reduction in other non-home contacts to estimate what kind of blunting of the peak of the pandemic and shifting to the right to slow the spread we might see with different durations of pause. So the first curve in black is a 2-week pause, and all the way over on the right you can see in yellow a 16-week pause. The purple shaded area represents the range of available bed capacity for the 10 most populous hospital referral regions in the United States, which have a combined population of 57 million. The horizontal purple dotted line represents the 2 hospital referral regions covering New York City. And you can see that New York City has pretty much the least available hospital beds on an average day of these very populous areas. And so not a surprise that New York is already experiencing the overflow and the need for alternative care sites. Next slide. I think as everyone on the call knows, one of the most visible aspects of the social distancing efforts has been school closures. And you can see that virtually all of the states have some variation of school closures. I'm told that today in Georgia we just moved from closed until May until closed for the academic year. And so this is a rapidly evolving picture. In gray, it's not no data, but it's closed until further notice, a rather ominous phrase. Next slide, please. Although it's unprecedented for us to take this kind of incredible social measures nationwide, really never seen before in the United States for this extended period, it appears that people are behaving according to the recommendations. These data show mobile phone information about the maximum distance moved by a person's phone in a particular day. And you can see this 6 states are shown here, with virtually all of them showing a dramatic decline after the first wave of school closures on March 14th, and then a continued decline once the announcement was made of that initial 15-day pause. Next slide. Another way to look at mobility is based on what's called City Mapper, where people look for the route to get somewhere, something like Google Maps and directions. And that shows that Seattle in purple began reducing their mobility based on this data source earlier, and Seattle was the first site in the country with that community spread from a long-term care facility. And then we saw subsequently drops in New York City and Washington, which were more recently hard hit. Next slide. It's been fairly, back one please. It's been fairly impressive, I think, to see the technologic and creative innovations that people have identified to enhance the ability to socially distance. But one of the low-tech approaches to social distancing seen at a carry-out venue in Atlanta was this masking tape, which measured 6 feet distance from one person in line to the next one. And we were very proud that the masking tape was officially designated the CDC social distancing limit. Next slide, please. To just wrap up setting the stage here, I want to say that this is dynamic and continually changing epidemic. CDC has developed interim resources that we update as we get more information, as we learn of new challenges and new problems, and that we're always interested in knowing how we can be serving institutions, communities, states, and partners to really help the public weather this challenging epidemic. I am really looking forward to the discussion and to hear about the downsides of this attempt to try to protect people. We know that this is an enormous social experiment, and anything we can do to minimize the negative effects while protecting health and really protecting the healthcare system to serve us all, I think will be very much worth learning over